I'm gonna start recording, and just Alexis, you can start whenever you're ready,
Okay,
and introduce your guests.
will do. All right, first of all, thank you, everybody that took time out of your busy schedule. I know it's a very serious time for us in our country, and every minute counts. So we're going to make sure that the minutes that we use are going to help you and help others, your family members, your friends, and those in our community. Today we'll be talking about PrEP with Dr. Morgan and with Natino Thompson, who will give us a little bit of information about PrEP, why is it important, and what is PrEP. So we're going to start this conversation off with Dr. Morgan, who is in charge at one of the directors at the Bahamas National HIV/AIDS Center, who works very closely with persons living with and affected by HIV and AIDS. So in this particular segment of our topic, we will be talking about and asking him questions on PrEP. What is PrEP? The reason why PrEP is important, and asking him some statistics and giving us some information on the way forward. Let's welcome Dr. Morgan. Dr. Morgan, are you there?
I'm here. Good evening, everyone. Good evening, everyone.
Good evening. Take it away, doctor.
Yes. Well, thanks for having me, Alexis. But by way of introduction, and Alexis, we would have spoken about this. I would have spoken about this with Natino also. About 2 weeks ago, I had in my office, I had two young men, two gay men, who were actually in relationships. They had partners, and they tested positive. They tested positive in my office. And this was a very interesting week because the two of them gave the history of having partners who they asked repeatedly to go and get tested. And so their partners, unfortunately, dilly-dallied around it. So their partners were not very, they didn't want to go and get tested. The long and short of it is that these two young men who very gifted, very talented, when I had to tell them their HIV positive result, both of them told me, oh my goodness, I wish I had taken PrEP when I had planned in my mind to do it. And so after they said that, it really stunned me. And it made me think I have to do more to promote PrEP because it is so serious. It is so serious. In the Bahamas, about 19.6% of all MSM, men who have sex with men, are HIV positive. That number is way too high, and it is unacceptable.
Mm-hmm.
And so here it is, we now have preventative measures that could be used to prevent HIV. Why isn't the uptake of PrEP? Why isn't the uptake of PrEP higher than it is now? I thought when PrEP started in...
Hi, could we put our mics on mute, please? Thanks.
Yes. In 2016, when we started PrEP in the Bahamas, championed by our director, Dr. Nakia Ford, I thought PrEP was going to be, I thought people would be breaking down the doors of their private physicians, private offices, of public facilities to get PrEP. But PrEP uptake, unfortunately, has been pretty slow, and there are many reasons for that slow uptake. One of them is stigma. Stigma, something so important. Here it is, you have a tablet that could prevent you when used with condom, that could prevent you from getting...
Hey, on it now, Steve Gutierrez.
Hello?
Sorry, as you join the group, please, as you join the meeting, please turn down your mics or mute your mics, please, as you're joining. I'm sorry, we have people joining in as you're speaking, Dr. Morgan.
No, that's fine. That's fine. I understand. We have a tablet that you can take every day, under circumstances, what I'll tell you, and it can prevent HIV, which is a life-changing diagnosis. It doesn't mean that you're going to die. It's not a death sentence to have, but prevention is always better than cure. Even in COVID, prevention is better than cure. Why is the uptake so slow? So stigma has something to do with that. But that's just my little introduction. But let's talk about PrEP. What is PrEP? So in 2012, the FDA of the United States approved a tablet that can be used to prevent the transmission of HIV. and in high risk groups, meaning groups that are at high risk of getting HIV. And some of these groups are men who have sex with men, um, men who have sex with men, and the substantial risk means each who has sex with men who has a partner who is positive, MSM who has recurrent STIs and has a high percentage of sexual partners, or who practices frequently condomless sex, meaning they don't use condom all the time. They're very irregular in their condom use. And men who have sex with men who participate in transactional sex work or commercial sex work. But it's not only men who have sex with men, it's also heterosexual men and women. One of the partners may be, and I forgot to say, one of the partners in MSM relationship may be positive and one may be, we call that serodiscordant relationship. One partner is positive, one partner is negative. So we put the person who is negative on PrEP to prevent them from getting it from their partner. Men and women who have regular STI, who practice condomless sex, who may also be transactional sex work. And one may have a partner one may be positive, one may be negative. The part who is negative is placed on to prevent transmission. And then we have a third group, IV drug users, which is not so much of a problem here in the Bahamas. But, so these are groups. And me telling you the statistic of 19.6%, meaning nearly 1 out of every 5 M has HIV, right? I'm noticing in my practice that a lot of young men in their 20s, early 20s, a lot of young MSM are turning up positive, None of them are in relationships where their partners have been forthcoming with the diagnosis of HIV. A lot of them practice condomless and they take risks. And a lot of them present to us with PrEP. So we're talking about PrEP. What's PrEP? PrEP is post-exposure prophylaxis, meaning if you have been exposed to HIV in a sexual manner, meaning a condom break, or you may have sex without a condom, whether it's in or receptive sex, meaning that you're receptive, meaning that you're aborted, they can go on HIV medicine that prevents them from getting HIV for a month. Now, if someone continually presents me, if someone continually presents me for PrEP, meaning post-exposure, meaning they continually find themselves in these scenarios where having condomless sex, that person meets the criteria also for PrEP. That person
Excuse me one second, Dr. Morgan.
is an eligible.
Excuse me one second. Guys who just joining in, can you please put your mic on mute? So whilst we have a presenter talking.
I think you could also mute them as well as the host. Yeah.
Yeah, William just told me that. So let me go ahead and just mute participants then. As soon as I learn how to do that.
Go ahead, Dr. Morgan.
Okay, and so these are the groups of people who
get the next one. You put on the water first and we can start boiling.
Okay, so PrEP is one time, once a day. Now, a lot of people come to me, and these are the criteria. So a lot of people come to me not knowing about go on PrEP, not having a condom. You don't just use PrEP. I am not supporting.
Dr. Morgan, Dr. Morgan, you're muted. So unmute yourself, Dr. Morgan.
Sorry. Oh, I'm sorry. So I'm saying PrEP is not supposed to be used like condom. It's not a condom. It's not to be popped right before you're having sex. That's not how PrEP works. You started on PrEP, there's a procedure. When you come to a care provider, whether it's an HIV specialist, an infectious disease specialist, or, and I hope this happens in the future a lot, whether it's your primary healthcare physician who's prescribing PrEP for you, right? There's a procedure. In medicine, you have to take a history. I have to first find out if risk to take it, right? I have to get your sexual history. I have to find out if you've had recurrent STIs. I have to find out if you have a partner who's be positive, if you're one who practices condom sex frequently. I have to find out if you even take drugs, because risky sexual behavior has been shown to be tied to certain drugs, the taking of certain illicit drugs. So all of this I have to find. I have to find out if you've had an STI within 6 months. I have to find out if your partner has an STI in the last 6 months. I have to find out if your partner, not necessarily you, practices risky sexual behavior, if that information is known to you. All of this information is important in the sexual history. And then after getting your sexual history, there's an examination. People could tell you they don't have an STI going on. And I always tell my patients, I want you to be comfortable with you. You're my patient. So I have to examine you from head to toe. Because a lot of people would say, they will see me and say, Doc, you know, I have this bump, but I saw me 2 weeks ago. You didn't tell me about it. So I do a thorough examination from head to toe. Some patients get a little embarrassed, but as I always say, I check everywhere. Because you could have an STI they're not even aware of, right? Not only that, there's certain blood tests we do. I have to do an STI screen on you. I have to check you for syphilis, definitely HIV, because PrEP is for what? The HIV negative client, right? So I have to check you for HIV, specific HIV test. Oh, and I forgot to say in the history, I have to check you for acute HIV infection. Remember, a lot of people who take PrEP could be possibly in a window period. I have to check you for acute infections, fever, chills, myalgia. I have to make sure you don't have HIV. I have to make sure you have 4 weeks, because I cannot put someone on PrEP who may be HIV positive, because PrEP cannot be used to treat HIV, right? And so I have to take that. I have to examine you. And then I have to also now blood works, hepatitis B, hepatitis C, gonorrhea, chlamydia, yeah, sometimes even anal swabs, akin to an anal pap smear. I have to check that. Gonorrhea, chlamydia, syphilis, as I said. I have to do a full STI screen on you. I have to do a full STI screen on you because I have to make sure these things are treated, right? And so then now you become eligible to start PrEP. And then I tell them, you don't pop it like a pill or you don't pop it as if you're using a condom. When you take PrEP, and sorry, your kidney function too, because you know PrEP can actually cause renal impairment. But once stopped, that is reversed. And so I hear a lot of people say, someone just came to me the other day and said, I hear PrEP has caused kidney failure. Would you prefer to get HIV versus taking a drug that could cause impairment and really doesn't cause frequently? And if stopped, it's reversed versus HIV, you see? So a lot of people make excuses for using PrEP. And that is why more education is very important. So the patient's PrEP, you have to tell the patient in rectal tissue, the efficacy, the drug levels of takes about 7 days in rectal tissue. In cervix and vagina, with a female, it takes about 20 to 21 days, right? In penis, in the penis, I haven't read a recent study on. From what I've read, that the jury is still out on. So it takes about 7 days to really be effective. And for it to be effective, you have to hit every day, every day. And guess what? PrEP should be used with condom. And if you have a positive partner, I would ideally prefer that partner to be virally suppressed. So you have three backups. Your partner is virally suppressed, you're using a barrier method, which is a condom, and you're using PrEP, right? Don't forget condoms sometimes break, people become exposed, right? So, and so that's PrEP. And the client is monitored every 3 months, right? You have to check their HIV every time they see you, right? And you do their sexual screen every 6 months, and their kidney function every 6 months. Some say every 3 to 6 months you screen, right? Right. And so the patient follows up with me every 3 to 6 months. If PrEP is stopped for any reason, between 7 and 10 days, there's no coverage. It doesn't cover you, it doesn't protect you. And so a patient has stopped PrEP for whatever reason, if they can't tolerate it, if they're not in risky scenario anymore, because a lot of people take PrEP, they're in a risky scenario, or if they're in a relationship, when they come out of that relationship, they discontinue PrEP, right? Remember, discontinuing PrEP, the efficacy or the effectiveness PrEP wanes between 7 to 10 days. So if someone is off PrEP and they come to me and they say, oh, I had unprotected sex, I have to put them on PEP, post-exposure, to cover them, because they're now outside of the protective period, okay? So people do discontinue PrEP for various reasons. As the care provider, I have to inform you that you're not covered after 7 days, right? And so you need to be on PEP. And it's worth repeating. If someone comes to me constantly for PEP, meaning, doc, I had condomless sex the other night, then they come to me another 3 months, I had condomless sex. This patient is an apt client for PrEP, because this person is having multiple exposures, and they will definitely benefit from PrEP. And so that's the story of PrEP. PrEP is necessary. PrEP is necessary. A lot of young men, 20s, I'm seeing who are turning up HIV positive. Relationships and their partners are not forthcoming with the HIV positivity result. And that is why it's so important to know partners. It's so important to be on PrEP. So important to be on PrEP. PrEP is, we're in times where PrEP is a necessity. A diagnosis of HIV in your early 20s, diagnosis of HIV at any age, but young gay men need PrEP. And I cannot emphasize that enough. This is an urgency. This is an urgency. All right? Thank you so much.
Thank you, Dr. Morgan, for that information, vital information on PrEP for our community. I will now turn it over to Natino, who will give the reasons why it is necessary for our community members to engage with health officials. And let's talk a little bit about the stigma, why most community members won't access PrEP. I will give that to Natino.
All right, good evening, everyone. I think that it's important to engage with ministry officials simply because, as Dr. Morgan would have stated, we're seeing large numbers through the data presenting themselves. And I think that 19.6, as Dr. Morgan would have said from the study, that's high. That's really high. And I think that everyone within the community understands that those are men who sleep with men who don't necessarily identify as gay. While we understand that, I think in this heteronormative climate that we live in, it's important to understand that you're always at risk, because while we're working through our traumas, while we're working to become better people, we're still stuck with these ideas of what it means to be, I guess, a man and woman in the Bahamian society. And as we move away from those ideas and embrace who we truly are, there's a need to protect yourself until you can get to that point or that place within your life, right? And so sometimes you're in positions where You meet people, and you feel the moment, you know, and you have great sex, and sometimes you don't use a condom. And so, as Dr. Morgan would have said, like, it's very important that that we be engaged in getting the PrEP. I think it's necessary to engage the ministry and the officials, simply because you want to protect yourself. You should be getting screened every 6 months, every 3 months, like within that time frame. I think one of the things that through the research that I've done is I think that we need to give back ownership and the knowledge to people over their bodies. I think that you know your bodies very more than you know it better than anyone else in the room. And so it's imperative that you know your body, you know when your body is out of whack or when it's not functioning properly, to be sure to be safe. Make sure that you have your HIV status checked regularly. Make sure that you're engaging within the community and medical officials, just so that you could have enough information to protect yourself. The second part of it again, could you repeat that for me, Alexus, so that I could answer that?
The stigma surrounding persons not accessing what is available to them, because what is accessible may not be, I mean, what they can access may not be accessible for them or available for them based on stigma and discrimination.
All right. I think that now this is a key part of the issues that we face in the LGBTQ community, right? And I think there's no one solution to fix all of this, right? But I think that you know that you have key persons like Alexus and other persons within the community you can reach out to, who can get in contact. I think Alexus offers home examinations or rapid tests. And so, if you have a problem, or if you think like, if you feel the stigma is too great for you to be seen at the HIV prevention center, then contact someone within the community who I'm sure can get in contact with Alexus. And if Alexus can't do it, I'm sure that she could put you into contact with someone else who can administer the test. I think this is one of the things, as we fight to make things better within the Bahamas, as we fight for all persons to exist within this space, use every avenue that is available to you. I think that it's important at this point right here to underscore that we are fighting. We are fighting for visibility, and we will not stop fighting, right? But until we can see the results that we need, so that we can have the level of comfortability and live a life that is the ideal desire for that which we envision, like, take advantage of these resources. I think I remember I decided on my own to go to the HIV and Prevention Center, and that's where I actually encountered Dr. Morgan for the first time. Sitting down with him for the first time, having that conversation. Now my first time at the lab across, I can to take the HIV to get my HIV status, it wasn't the best, but I went back again because I understood that if I'm gonna make the best decisions for my life, I need to be informed. And I think sometimes for LGBTQ people, we have to choose between life and death and stigma. And it's not a fair choice. I understand that completely. It's not a fair choice. But I think that that when you weigh the consequences of dying of HIV, which is at this point in time, it can be prevented from happening, then you sometimes, if you can't reach anyone, the best bet is to go into the center and get it done. I know that may be easier said than done, but again, we know that this stigma is not going away anytime soon. So what we have to do is we need to provide ourselves with enough knowledge. You need to be reading up, because the truth be told, that's one of the only ways that you can prevent or guard yourself against the stigma. It's when you're informed. You need to read literature. So one of the things that I try to do is to mitigate or try to navigate, as I navigate the society, I try to understand more about who I am as an individual and whatever that means. So by reading, one of the things that I turned to in particular was reading James Baldwin, one of the most prolific queer writers, even though he didn't identify with the word gay, right? But so one of the things I decided to do was I read almost all of his books, if not quite a number of them. And then I learned about Bayard Rustin. I learned about people, I mean, who had walked, I guess, this path before, who had pioneered, who had kind of traversed these stigmas and these kinds of discrimination that we've all faced. And it kind of gave me the courage to just stand up a bit more. Again, it doesn't make it more easier. But when you can understand that in the 1960s and even before, in the 1940s, when James Baldwin would have lived, that he faced a lot of the things that we talked about, even though he's an American, an African American. I think the similarities are there, and you try to draw out exactly what you can use for your journey as you move along in life. Again, if you're transgender, you want to be Marsha. The name escapes me right now, but she's one of the famous persons who started who was at the Stonewall riots. You want to be as informed as possible, right? It means that you now have to read and get more equipped. I wrote a paper on LGBTQ experiences in the Bahamas. It's online. You can Google my name. It was published in the Yale University Journal. Read that. It's through these kinds of, and again, I know, again, this may be easier said than done, because the truth of the matter is a lot of our community are disadvantaged, because if you're dropping out of school at ninth grade, right, because you're transitioning to be to be who you authentically want to be, which may be a transgender woman or man, that may mean that you don't have the necessary reading skills, right? But I think that in those times, I think that we have the community, or we should be building the community where there are persons who are more than willing to go along the journey and help you understand what needs to be done in order to face the discrimination and stigma. Again, we may not be able to protect you from it, but we can journey with you as you walk along. And I think that as we kind of build that community and build the strength and that kind of resiliency, right? Knowing that you have weaknesses, we can still offer help. And I think that there's no shame in that. I think that we're here. If we need to teach you how to read, if we need to do whatever it takes to get you to the point where you can stand on your own 2 feet as the person that you desire to be, we're here to do that. And I think that that's a critical part of why we're even doing Pride, right? Because we want to ensure that this community has the necessary tools and is equipped with the necessary tools to offer people means of resistance. Because being who you are is a resistance against the environment that you're in, right? So every day you get up out of your bed, it's already tough enough just to slide your feet into the shower and face the world, because this world is not exactly what your heart expected, and definitely it's not something that you want to be able to live in comfortably, because people are always finding ways to discriminate against you. Right? We understand that the Constitution does not protect our rights, right? There's nothing in the Constitution that protects you from being discriminated against based on your sexual orientation. And because of that, we need to use the community resources that are available to us. So again, there's no one strategy to fix all of, I guess, what the stigma and discrimination that you are facing. But know that if you need someone to journey with you, that we're here, that we have data, we're getting data. I'm doing more and more studies just so that we could have the data on hand. Because one of the things that we find is that whenever we go or try to present issues or get funding to implement programs, there's always this, oh, we need data, we need this, we need to know what's actually happening. And so I've resolved in my mind to be one of the writers that chronicles exactly what's going on so that we can have access to that information. And my whole thing is that whatever we do, we should be making it much more easier for our children and our children's children. And I think that as we develop these community strategies, we'll be able to, if we're serious about it, and if we're actively seeking to be better in our personal lives and as a community, we could see the eradication of HIV within the Bahamas. I think that because of science, I want you to get this. Science has been able to stop the transmission of HIV from mother to fetus. That's a feat in and of itself. In the Bahamas, I think the rates are extremely low of that happening, right? And so if we could do that, right? And it took I think it was 40 to 50 years to get to that point. We could get to the point where we could, where no person has to endure the stigma of having HIV in the Bahamas. And I think that that's something that we should be looking at. That's a goal that we want to keep our eyes on, all right? So yeah, that's it.
Thank you, Natino, for that in-depth introduction on stigma discrimination and barriers to accessing services. So I'd like to speak more with Dr. Morgan and a few questions I'd like you to address. Is PrEP free in the Bahamas?
Yes, PrEP is free in the Bahamas. It is not only free in the public system, it is also free in the private system. It's readily available. It is readily available.
Can you put in the chat? Can you put in the chat box, or you can actually say it over the air, your contact numbers so persons can be able to get in contact with you?
Okay, so my cell phone number is 424-0341. Again, that's 424-0341. And if you're calling and can't get me, you could WhatsApp me. I check that every 2 to 3 minutes. So feel free to avail yourself of PrEP. And just going beyond what Natino said, PrEP has its stigma too. PrEP, when the studies were done, people thought that PrEP was.
That's my next question.
Oh, it was? Okay,
Go ahead.
okay.
Right on target. That was my next. Let's talk about the stigma surrounding PrEP, because we do have some pundits and some persons who feel that if you're on PrEP, you're a sex worker, you're promiscuous, you're all will encourage persons to have more sex. So we do have pundits and people out there who are against PrEP. But I want you to dispel some of the myths and some of the concerns, which we will open up the floor in a few minutes for questions. But just talk about the stigma surrounding PrEP.
So there is a stigma. When the studies were done, people who used PrEP were called Truvada whores. Truvada whores. And people believe that PrEP would have made people more indiscriminate in their sexual behavior, meaning that they would have just be having sex all around the place unprotected. Other STIs would have increased substantially. And a lot of the studies, nearly all of the studies showed that this is definitely not the case. There was not a significant rise in STIs. I mean, other STIs, meaning STIs other than HIV. When clients use PrEP, there was not an increase in STIs. So there's a stigma of PrEP. A lot of people think that if I've used PrEP or if someone know I'm PrEP, I'm just sleeping around. I'm a whore. I have no morals and that kind of thing. But new things and things that are outside the norm always carry with it stigma. But we have to think to the greater good, how we could end HIV, how we could end HIV. PrEP is one of those powerful preventative tools that could actually take us toward ending HIV. Ending HIV. I have all of the people that are on PrEP, they're using it consistently. And every 3 months they have their HIV test done. And I haven't had one positive person turn up. And a lot of these, bear in mind, are in relationship with HIV positive partners. And they continually turn up HIV negative on their PrEP. And so I can't say it enough how important PrEP is. We have to move beyond the stigma of PrEP. And in fact, another discussion, which is going to be a hard one to sell you guys, is PrEP in the adolescent population. Now, how we can sell that one? I know how that one go. That one could be thinner. But we have adolescent homosexual males who are having sex with older men, who are having condomless sex, who are turning up with gonorrhea, chlamydia, and syphilis. And we know that Once you have things like syphilis and herpes, your risk of getting HIV is even higher. You know, multiple STIs, even before you get HIV, is usually a sign that if you don't change your behavior, or if there are no, or if this behavior isn't intercepted by preventative measures such as PrEP and condom use and male circumcision, HIV is down the line waiting for you. So PrEP in the adolescent, not a lot of studies are on it because we know this have a lot of legal ramifications, a lot of moral ramifications, a lot of religious ramifications. It's a hard sell, but I think studies are in place looking at PrEP in the adolescent group of clients. Yeah, so stigma is attached to PrEP, but we're gonna have to get beyond that, and people are gonna have to get comfortable with it because it works and it prevents you from getting HIV.
Just to piggyback for 2 minutes on what you're talking about, adolescent access to PrEP. Adolescents' access to healthcare on its whole is going to be a big debate because of the laws of our country. A person can engage in sex at age 16. They can consent to sex at 16. Females can consent to sex at 16, but they cannot access healthcare services without a parent until they're 18 years of age. Yes. And for those engaging in same sexual activities, the legal age is 18 years of age. So how our advocacy now and our AHA tools that we've been taught, in order to start with the introduction of adolescent health services, introducing PrEP, we have to start dealing with our lawmakers, our decision makers, and our policy makers, and start to agitate and advocate for access to healthcare for everybody, starting from teenagers. When they start teaching family life, they need to start to be inclusive and diverse in their conversation so people can know what's available, because sometimes what is accessible is not always available. And that's why we at the D'Marco organization would like to bridge that gap with Ministry of Health officials and persons in our community, so they don't have to feel when they go to the center, they're going to be stigmatized or they don't feel comfortable there. We have put in a lot of work as far as working with the HIV center, and I can say that Dr. Morgan has been one of those persons making sure that we are comfortable, making sure that we can access services. Also, Dr. Nakia Forbes, she has made sure that center is where it needs to be in accessing services. We do have a system. If you do have a problem, when you do have that services, feel free to WhatsApp us, feel free to text us, and I guarantee you, you will get your issue resolved. For persons who need to pick up medications, if you are HIV positive, we have programs where you don't even have to come to the center. We collect your medicine and we bring it to you.
Yes.
Also, those who need to be tested for HIV, you don't have to come to the center. But you do have to come to the center after we give you the result, whether it's negative or positive, so we can either guide you if we have to put you on PrEP, or we have to put you on PEP, or we have to put you on ARVs. So I'll let Dr. Morgan speak to that. Go ahead.
Yes, yes, and remember, you don't have to be tested at the HIV center. That is, I mean, it's free there, but you could go to your primary healthcare provider. You could go to any doctor in their office, and you could get tested for HIV. And remember, if you are HIV positive, you don't have to receive care in a public setting. There are private providers who are well-versed in managing HIV positive patients. They can treat you. They can treat you. And usually, if they have a question, they will either speak to Dr. Forbes, my director, or they'll speak to me if it's a complicated case. And so we want to decentralize. We want people to feel comfortable in a private setting when they're receiving HIV care, because though we want to get rid of stigma, it's still there. That's the reality. And so people will feel more comfortable in a very private setting. You could have testing in private settings. In fact, we have a few primary care physicians, including me, who provide PrEP in a private setting, right? Publicly and privately, I provide PrEP. And there are other healthcare providers, Dr. Forbes, and we have another infectious disease doctor who you may not be too familiar with, but he's Dr. Bonamy. He's also an ID specialist. You may see both of them because of this COVID, but they're the two specialists in the country. They provide PrEP, they provide PEP, just like I provide PrEP and PEP in a private, more confidential setting. Although the center is very confidential, people are very wary of public settings. But believe you me, public settings are very private. Very few people have access to this information, and people don't know this. A lot of people still would feel uncomfortable. So I say that to say that you could receive your care, whatever it is, in a private setting. Remember, if a condom breaks, or you have unprotected or condomless sex with a partner whose status you don't know, or you may even know, and you want to protect yourself, you could go on PEP, but you have to present to a healthcare provider within 72 hours. And you see, and it's amazing, even in 2020, a lot of people don't know about PEP. They've been hearing about PrEP because of the US advertisements. But PEP, you can take PEP for 1 month to prevent you from getting HIV. If you've had condomless sex, the condom may break. Even for care providers who may have gotten a needle stick, PEP, post-exposure prophylaxis, is available to prevent you from getting HIV. But you have to present, you have to present within 72 hours of the incident.
Okay, I want you to touch on one final point before I open the floor for questions, and that is couples who are testing, they're HIV positive, but their partner is negative. I want to talk about the benefits of that in our community.
Yes, so PrEP, one of the indications for PrEP is for what we call serodiscordant, meaning one partner has HIV and another partner does not. And so the partner who is negative goes on PrEP to prevent them from getting it from their positive partner. Now, I've seen partners who come together. One is positive and one is negative, and this is very progressive. That is very progressive. I just saw one yesterday. One partner is positive, one partner is negative. We need to have cover all grounds, because I'm in that setting. I not only focus on PrEP with regards to the HIV negative partner, but now I could encourage the positive partner by taking them that you're on the HIV medication and the levels of HIV in your blood are so low that they're undetectable when we check your blood for virus. It doesn't mean that HIV negative. It means that the amount of virus in your blood is so low, meaning that you're taking medicine, the medicine is working well, and that the chances of you transmitting that virus from you to your HIV negative partner is nearly zero. And so that's why we fight so much to get people on HIV medicines and to get them virally suppressed or virus to zero, because it stops the transmission of HIV. So you see how important it is? So when I get a setting with a couple where one is positive, one is negative, I feel like I could do good work in that setting, because I could work on the HIV positive person and encourage them to become negative, to become virally suppressed, not only for themselves, but also for their partner, right? And the studies have shown that if even outside of PrEP, if one of the partners is positive and they're virally suppressed, they don't transmit it. They very rarely, it's a small percentage of them transmit it to their partner who is negative. And I could tell anecdotal stories about that too, but the studies have also shown this. And so getting patients virally suppressed is very important. Right? And I truly wish we could really get to the point in this country where we could have open discussions about PrEP, even in heterosexual groups of people, where, in these times here, and I'm sorry to say, and I know we hear it anecdotally, I don't have the study to show, there's a lot of transactional sex work going on. We got to talk about it with men, with MSMs, men who sleep with men, who don't even identify with being gay. There's a lot of transactional sex work occurring in that. exchange of sex for money or commercial sex work. And a lot of heterosexual couples or people, the heterosexual orientation, who are exchanging money for sex in these hard economic times. And so PrEP, there again, PrEP is a necessity. And my patients tend to be open with me. A lot of them open up to me and say, Doc, yes, I have sex in exchange for money. These are hard things. And so these patients are eligible, and they are eligible candidates for PrEP. So even in COVID now, with all these hard economic times, people are having sex for money. PrEP is a necessary prevention tool to stop the transmission of HIV. Thank you.
Thank you so much, Dr. Morgan, for that insight and for the information that you provided. We want to open the floor right at this time for any questions, so you can just unmute your mic if you have a question for Dr. Morgan.
Okay, so Dr. Morgan.
Yes.
I have a question concerning the incidence of adolescent sex, because it is actually something that's sensitive, but it's actually taking place. Quite recently, I have a 15-year-old nephew who was on Grindr, and this is one of the concerns I have, because even if I wanted to use Grindr, I have to be aware of the fact that you have young boys on Grindr, underage boys, adolescents who use Grindr, and who are unaware and who have sex for whatever purposes.
I think you came out.
Adolescent boys who are having sex with other men. Yeah. How could older men, particularly, how could you educate them?
Can we hear him?
Say development where they're not at a place where they could even accept or probably feel comfortable, or they're trying to work out what sexuality even means and identity. How could it be made comfortable for them to have this conversation with these young boys?
The whole conversation with, and Alexus may know this better than me, the whole conversation with adolescents and young guys when it comes to sex, and especially when it comes to MSM sex, it's quite difficult because of stigma, because of fear, because of discrimination. You know, parents have a very hard time accepting that their boy is attracted to men or has sex with men. So it is a challenge. It just means getting into the schools, and when you have that, you know, I do STI talks all the in schools. I've done it in junior high, primary high, and I do it at UB frequently. It is just meaning when you're talking about your herpes and you're talking about your HIV, you're talking about your gonorrhea and chlamydia, I personally use that opportunity to talk about HIV and then go into PrEP. I just ease it in. I could see the discomfort on the students' face, the discomfort on the teachers' faces. You can imagine if parents were there. But this is a conversation that is going to have to be more open. But I just wish somehow PrEP in the Bahamian setting, and I've said this before, somehow be shown on these sites so people could know that PrEP is available. I don't know if I'm answering the question right, but when it comes to the spreading the word about PrEP, sexuality, preventative measures from getting STI, I think if you do it in the home, if you do it in the school setting, that's where you may have to start. I don't know if anyone wants to chime in and expand on that some more.
I think collaboration is important, And we need to keep in mind, we do have a focus on youth department.
Yes, we do. Yes, I forgot to say that. Yeah, headed by Miss Nanette DeVoe. Yes, we do have a focus.
I think tapping and collaborating with their department to get that word out will be the way forward, especially on a mass scale. It's going to take some tough decisions, and it's going to take collaboration to get the word. We cannot bury our heads in the sand anymore. Young people are having sex; they are sexually active. And then two, do you know how hard it is for a person to come out or identify as a gay person? That's number one. And then as HIV positive, that's two things that they're dealing with. And their contraction of HIV may have been very innocent. Some parent may have thrown them out. They live with a man or live with a woman and they contracted this virus, not of their own fault, not even aware of how to protect themselves, or a person showing them statuses that are fake. So you show me a piece of paper that says you're negative, I'm going to, okay, you're negative, good. So we have a lot of barriers and issues within our own community. But again, starting with the focus on youth program, and it takes us in our community to talk to our children. We have something called house families. And I think the importance of this message was trying to be preached years ago through Pride Bahamas, as far as how the importance of family, LGBTI families are important, to talk about real life issues, because when parents throw them to the street, we become these children's family. We become their families. So you still have to take them to school. You still have to keep them up with their doctor appointments. But we need to start in our own community to have this open and honest conversation with our family members. So we have a part to do as community leaders and as house parents and as people who are a part who just care about people. And I always say this, you could take me to the club to party and drink, but you can't take me to a doctor's appointment. And again, it comes from confidentiality, the lack of confidentiality within our community. But again, we have to take responsibility for our own health. We now have to become responsible adults and young people for our own health. And we have to ensure that you guys have the tools that you need in order to protect yourself from HIV. I'm going to ask for one more question. Anybody else?
Yes, I have a question. Yes, I have a question. My question is, must one person be tested before they are given the medication of PrEP or PEP?
Yes.
Go ahead, Dr. Mark.
Yes, you have to be tested, and as I said earlier, we do a full sexual screen on the client before we even start PrEP, and definitely the patient has to be HIV negative. Remember, the tablet that you use for PrEP is really half of the regime, half of the whole package you to treat someone with HIV. So if you're if you turn up HIV positive and you're only on one pill, you could create resistance. And then again, you're not being treated properly if you're HIV. That's why that is why the top criteria for starting PrEP is you have to be HIV negative. That's the point. To be HIV negative and to continue being HIV negative by continually taking PrEP. And so you have to have a full screen, syphilis, because we want to treat a lot of those STIs that actually set you up for HIV. What people don't realize is things like herpes, any ulcerative sexually transmitted infection like herpes, syphilis. It is easy for HIV to move out of semen into those sores or into those that's the quickest setup to get HIV. When you have these ulcers from other sexually transmitted infections, herpes and syphilis. It's the perfect setup to get HIV. And that is why when you go to a healthcare provider and you're presenting with these current STIs, you have to have the care provider should pick up and say, you know what, this person coming with all these STIs, HIV is going to be next. I have to intercept. And that is why PrEP is so important. And that's why taking the sexually transmitted infection is so important, right?
So the introduction, we see here, the introduction too can be from STIs. And I think our community has to realize that we are vulnerable for these things. The healthcare needs of our community are totally different. I wouldn't say different to the fact as the general population, but there are some things that we need to get done, such as anal pap smears. And doctor, I want you to touch on that a little briefly about that. In our community, there are some things that we have to do with our bodies. We have to ensure that we stay healthy and that we stay clean. I want you to speak on that for a minute for me on the anal pap smears for our community.
Yes. One of the STIs that men who have sex with men are predisposed to are anal and genital warts caused by HPV virus. So I know we're talking about pap smear. Also, we have to also talk about the HPV vaccine men who have sex with men, because the warts are caused by HPV. So the warts, you could be HIV negative, and again, these warts are a setup for HIV, because when they bleed, HIV could move right from semen right into your bloodstream through the warts. But another thing I'm most concerned about with warts is that they transform cancer, anorectal cancer. So these warts, the big condylomata acuminata, or anal wart, they could transform from just being benign lesions or non-cancerous lesions to cancerous lesions. And so MSMs are at risk because of HPV and these warts for anal rectal cancer. I've seen it many times. Many times I've seen it. And pap smear screening, the literature isn't so clear how often, when, or even if MSM should be screened regularly with anal pap smear. So it is done, but the literature on that, and I'm following that up closely. I was just talking to someone just before coming about finding the literature and the guidelines and the recommendations to see how often men who have sex with men be screened. But it's very important, because just like you do a vaginal or cervical smear in a woman to look at abnormal cells on a microscope, when a man who has sex with men has the pap smear, we could look under the microscope and changes, and then act on those changes. And I think that you could even intercept from having non-cancerous cells to cancerous cells. So pap smear in MSMs, I see the importance of it. And so it's very important too. And I can't remember how often you ought to do it, but I can get back to you on that. But it is very crucial, because, and I'm seeing a lot of young men with anal warts, a lot of MSMs, young men in their 20s, 30s, in their 40s with anal warts. And there is that these warts could transform. And so when I see warts, I try to refer them to a doctor who could actually remove them surgically or burn them off right away, so that they don't transform into a cancerous lesion and become a setup for HIV transmission.
Well, thank you so much. I will just ask if there are any other final questions before we do closing remarks.
I have one more question.
Go ahead.
Out of curiosity, but every day, someone sends me a video of gay sex, and representations of sex, particularly in African American pornography, is normally bareback. Mostly all the ones I see are bareback. And the joke I've heard being made in the past is that they're often drugged up, right? That's why they do it that way. But I want to talk to Morgan to speak briefly on the incidence and interaction with PrEP and psychoactive drugs, intravenous drug use. What's the interaction of that drug with people who actually use psychoactive drugs?
The thing about it is, and one part of the sexual history on PrEP, if you have ever used psychoactive drugs, that is actually on the checklist in the history that I even use. Because we know that when you use these drugs, you're less inhibited in your sexual behavior. So you tend to do silly things. And I call it silly. I mean, we all make mistakes, but it is silly to have condomless sex with people you don't know. That is the height. That puts you at risk. Yes, mistakes can be made, but we try to prevent that. So what drugs do is they put you in sexual scenarios where sometimes you're not clearly thinking. You're not using a condom, you know. And that being said, remember, bottomless sex um, is you're easier to get. It's easier for HIV to be transmitted from receptive anal sex, being a bottom. And it is immunology too, because when you have anal sex, there's tearing, there's bleeding, and so your blood vessels are broken. HIV moves from semen right into your bloodstream, and immunology. Anytime there's tearing or there's trauma, your immune system kicks in naturally. So these poor immune cells, such as your white blood cells and all those immune cells, sit right there under that blood vessel saying, I gotta repair this tear. But what happens? HIV is right there waiting and infects. Takes them to your lymph nodes, and before you know it, you are infected. The HIV is spread all around your body, right? So drugs is tied into risky sexual behavior. And so that's the connection there. Thanks.
Any other questions? I will open it up for the next 2 minutes. Any other questions?
I wanted to make a comment.
Okay, go ahead. Thank you.
Hey.
Good day, how you doing?
I'm good.
I just wanted to encourage, especially all the different persons are here, that I don't know how many of y'all are registered with the National Health Insurance, but over the years, persons didn't want to be tested because they didn't want to go to the HIV center that was too public, and then private doctors cost money, etc. But now the government has made a way to pay for you to get private stuff and go to labs and be tested. I work with Dr. Pratt. She does my forms, send it in. I go get my every STD check, HIV check, diabetes because I'm a diabetic, etc. All covered by the NHI. So I think with all us leaders here, we need now to filter this information down to the young people who be around. The children ain't doing it because most of the time we ain't saying it. We got to tell them, know your status. This is how it's done. And like Alexus say, you can be to the club, but why you ain't taking them to see the doctor or go with them to the lab? This says more persons are easier to go and be tested when a friend carries them. Got to go with a friend, So we have a responsibility, and make sure. I made it my point this year to make sure sign up as much persons on the NHI because it's covered, and that was one of the main problems I had to battle with. That the stigma of the HIV/AIDS center, but then the cost of the private institution. Now it's available. So please share it. Each one, reach one. Let's make this happen. Like I said, we got to make our community healthier and make sure they know, along with condomizing. Sometimes I get ice thrown on me in clubs and stuff, bringing condoms and this stuff. Ain't nobody want this here, but hey, it's my own man, so they can't stop me. But I can put it there. You're responsible to take it and use it. Now, if they don't use it, I did my part. That and lubricant, because some strange stuff are being used for lubricant these days. Anyway, that was my 5 cents. Thank you. I love the presentation, Doc.
Thank you, Victor.
Thank you, Victor, for those comments. I will turn it to Natino for final comments, and I will wrap up after he's completed.
All right, I just think, I thought that Glenn asked a very important question. And I think that we've been talking with Dr. Morgan as well about the adolescent. I think that Alexus also talked about collaboration. I think we have to move to the point where we need to be, there needs to be a comprehensive sexual education within the schooling systems. That's one of the reasons why I also wanted to do more research. If I could get through with this paper, I did, last semester, I did this paper, this study, me and about 4 other persons, we did a study on negative attitudes towards same-sex relationships in the Bahamas. And the results were very astounding, right? I purposely do all of my work on the LGBTQ community just so that we could have this information. And I think that, as like I said before, it's one way to break down the barriers of stigma and provide you with information so that you could live the life that you envision within this kind of limited space. Because as I said before, because it's such a heteronormative space, and I think that we're all dealing with some form of cognitive dissonance. And I just wanted to say, because that's what I wanted to say in particular. I think that adolescents trying to deal with the cognitive dissonance of who they've been grown up or raised to be. And cognitive dissonance is just when you have two different ideas that actually are antagonistic or that oppose each other or contradict each other, and you're trying to work out what how they fit within your mind. They cause this mental anguish that we call, or this internal conflict. And that right there, along with the minority stress theory, where you have this kind of vigilance and all these other stresses, like these things are known to be prevalent amongst LGBTQ individuals. One of the things that I was talking with Alexus about is the fact that, and these are all conversations that are leading up to Pride. So this here is the initial step for us having these conversations. I was talking to Alexus about LGBTQ people not being included within the census. The census is happening this year, right? And nowhere on those census forms are they gonna ask for whether we're lesbian, bisexual, gay. These things help us to have answers about how many people in the Bahamas are actually LGBTQ. How many of them, you know, these are the things that we need. And when we don't have that level of visibility at the very top, and when I talk about the top, that's the Constitution, or it's not being done within institutions, it prevents it prevents obstacles and challenges to us getting our message across. And so I think that as we begin to do this work, and as you begin to support and even join in and do the work on your own if you can, once we're able to do this, I think that we'll be able to provide better policies, inclusive policies that actually make us the center of our narrative so that we can navigate this life within the Bahamas. I do not think, right, because we're going back to the stigma, I do not think that we should be leaving our country in search of a better country. I think that the fact that that's happening signals a problem within where the space that we're in, right? We have so many people that have left the Bahamas, and they're not just LGBTQ, Bahamians have left the Bahamas in search of better opportunities. And I think that if we can, I think that this is the ground, or this is the time or critical moment in history where we can begin to rectify some of these issues. We may not be able to get to all of them in time, but I think that we need to look at these issues that can help curb the stigma, that can help curb the discrimination, because if legislation is in place and that's written in the Constitution, the first couple years, 10 years, 20 years, it may take some time for that to settle in. But once that's in place, it must be upheld. It must be, it can be used in the court of law, which means that we won't have people dying, right? Because they are queer or because they're LGBTQ, right? In the Bahamas. And I think like this is the moment, this is the time for us to really come together as an LGBTQ community and stand up for what is ours, right? And I don't think that we should be afraid. I think we should feel empowered by the information that we're getting here. We should be empowered by everything that's being discussed here, because this is setting us up for the kind of future we want within the Bahamas. A future where you no longer have to hide, a future where you no longer have to feel afraid, a future where you don't have to feel the stigma, or you can move past the stigma, right? Because it's always gonna be there, right? Or you can move past, or you can end discrimination. That's a possibility. I think with all of these possibilities, we wanna keep at the forefront that you are exactly where you need to be, and you are exactly who you need to be. And there's nothing wrong with you. And so I think like that's the main takeaway, that all of this information about PrEP, all of this information about us talking about the stigma surrounding HIV, PrEP, and the good things that are coming out of these scientific studies, they're to help us become the people that we want to become. All right? And so yeah, that's about it.
Thank you for
that
comment.
Can I make a comment on that, Alexus?
Go ahead, William.
Natino, see, I have not really asked this question anyone because it really has not come up in conversation. But from my understanding of people that work in policy, especially with ours, because the Constitution does not speak in any way for discriminatory factors against any party, is why they say it's unlikely that you will get it changed for any one person. That came up when they were talking mainly about females, and it's also the example they're using to draw against the LGBT community. So their thing is visibility has to be increased in certain areas. It has to be a mindset change, not a constitutional change, because the Constitution already speaks to anti-discriminatory factors. But because we as a community allow it to continue and we do not hold people accountable is why it happens. So there's two very different points of argument, one coming from the government and one coming from civil society. But civil society is not taking what is given to them, is already there. The Constitution already speaks to it. But because we allow it to be a societal norm, it continues. Now, another point is the census is not happening this year. It has already been canceled. They canceled it because of COVID and the lack of a budget. But I don't know of any census that really speaks to sexual orientation. Their main concern is how many people in this country and who, where you are, what is your financial income. So sexual orientation is fine, but again, it's not something the government is interested in knowing. It's like saying, putting on the census, hey, have you experienced, what is the word I want here? Incest, which is something else they refuse to tap on. Or were you molested as a child? Certain things are not going to happen. So knowing that, my question still comes back to people when they bring these topics up is, what is the plan to actually get something done? Because you know it's not going to change when you bully the government.
Okay, in the United States, they passed an act that mandated that
we live in the Caribbean and in the Bahamas.
Nevertheless,
Okay.
that's not the issue. The issue here is that you're saying that this can't, because of their focus not being on it, that it can't be done. If we look around the world, we see where you can pass acts that mandate that information about people's sexual orientation be collected by governments. And I think that to suggest that just because the government isn't interested in doing it, that we not do anything, that's a violence against us. And I refuse to let that be my future. I'm not asking you to do it. You will do it because I'm a citizen of this country. I'm not asking you to include me. I need to be included. We should be included. I am a holder of the Bahamian passport, which means that everything that concerns my life should be taken into consideration when you're doing a census. And so I'm of the mindset that I'm not asking you to give me space. I'm taking space. And if you or anyone else has a problem with that, then deal with your feelings.
No one is denying it.
When you talk
that's
plans,
why I'm not understanding. No one is denying your space, and you're holding the Bahamian passport.
But actually, the Constitution, by virtue of the fact of not having the word sexual and orientation within it, is a denial of space. Because what it says then is you won't recognize me, you won't include me.
Okay, but does that not also say that if you want to use that analogy, then would that not also be the same thing for the heteronormative? Because it does not have the word sexual and orientation in it.
No.
Because heterosexuality is...
But heterosexuality is the norm, it's the default.
Okay.
It's the default.
But you can argue that point.
Yeah, that's what I'm arguing.
I mean, I was actually pointing it out to you. If you really want to argue the point, then argue the point in reverse.
I'm not sure I'm understanding.
I think we're going to have another session when it comes to where we at on the map as relates to policy and legislation in this country, which I do think is the time of discussion to start having. So we will schedule another Zoom in regards to that so we can actually debate that. So we want to give our final words to Dr. Morgan to give your final words. And in the comment section, we have a question. Alexus or Dr. Morgan, if this pill is such a magic pill per se, why aren't much more people taking it? What are the numbers to date with persons taking this pill as opposed to people not taking the pill or having no knowledge of such pill? Go ahead, doctor. And you can use your closing.
Oh boy. Yes, I could definitely use that, and then I'll tag on the closing report. I was just asking our epidemiologist that the other day. I'm gonna have to get back to you because I just asked her that about 2 weeks ago. But the uptake is slower than we would want it to be. Considering 19.6 MSMs, 19.6% of all MSMs in the Bahamas are HIV positive, our uptake, from what I'm seeing in pharmacy settings, is way down. It's way down. I'm going to try and get the numbers. I'm going to try and get the numbers to you, Alexis, so you could dispense the information. But uptake is slow. But this is not only a Bahamian thing. Uptake is slow, even because I have a colleague of mine who's doing her thesis on PrEP. See, people are interested in it. They're doing her doctoral thesis on PrEP. And uptake is slow, even in the United States, in the UK, in European countries. Uptake is slower than what was expected. When this drug was approved by the FDA in 2012, I'm sure they thought that every MSM, everyone who identifies as gay would just be so happy this pill. But the uptake is some. It may be concerned about the side effect profile of it. You know, there are so many reasons. It could even be stigma in healthcare providers. We don't think about that. But as a primary care physician, some healthcare providers may not know much about it. Some healthcare providers may have their own stigma against PrEP. So if they feel comfortable with it, they ain't gonna prescribe it, right? So what it means is that there has to be education, not only with the society at large, the population at large, or even the LGBT community, but healthcare providers too, government agencies, everyone has to be on board with the PrEP, especially healthcare providers, because my dream is that MSM or someone who identifies as gay could go to their private healthcare provider in their annual physical and have a discussion with their private healthcare provider on, doc, I'm gay, or I have sex with men, I would really like to start PrEP. And then that healthcare provider would know about PrEP, would know how to manage a patient from history straight down to dispensing the PrEP and follow up, would be able to tell them about PrEP, manage them, and that narrative goes on and on. That is my dream, that primary health care providers, GPs, other than specialists, would be prescribing PrEP in their office. But the uptake is slow. There's so many barriers. But I think these could really be overcome. And it has to be more discussions. There has to be people who are on PrEP need to become open and talk about it. A lot of the referrals I get are from people who are already on PrEP. So they tell their friends about PrEP, and their friends come to me, and I have people on PrEP now for 4 or 5 years. No, 3, 4 years. So we would like it to be as easy as someone, and this is my closing remark, we want to make it accessible. We don't want to make it taboo. We want someone to go to their GP and say, I want to start PrEP, doc. And it is my dream and my hope that the healthcare provider will say, okay, let's get started. And it could be that easy, It could be that easy. And thanks for having me, Alexis. And I hope we do more. There's so many topics in HIV, STIs, PrEP. There's so many levels of this that we could talk till like kingdom come on these topics. right? So thanks for having me, and I hope you invite me again to something like this.
Yes, definitely, Dr. Morgan. We will have you back again. And we want to talk, our next topic will be surrounding some of the COVID-19 concerns and fears that our communities have. Like, what are the best options for us as community members? Because persons living with comorbidities such as HIV are at risk for COVID-19, and they're at a high risk level for COVID-19. So we need to have this open, honest discussion of our high risk clientele that is at risk for COVID-19 in our country. And that will be our next Zoom topic we will schedule. So in my closing remarks, I would like to say this. We do have a community that is visible, but sometimes visibility is different for other persons. Some of our persons live with their family members, so their support can only be behind a computer screen, through a text message, through a WhatsApp group, or any kind of means of that, because at the end of the day, some of them are not open to their family members. So what they have to do, they have to conform and especially during this COVID-19 period, live in a coexisting environment with family members who may not be open to who they are, who may not be open to their sexuality or their gender identity. So what we're trying to do is we're trying to create space. And this is a space that we're trying to create. Zoom is a platform where we can come on, we can have these conversations, we can talk about these things, a time to break free from these stressful daily life activities due to COVID-19. And in my closing remark, I want to say we are here and we want to support everybody in our community, not just trans people, not just gay people, not just bisexual people, but lesbian people also. We have forgotten that we have a lesbian community that have concerns and that have issues and that want to probably talk to a doctor, that want to find out, hey, I am a lesbian woman living with HIV. How do I have this conversation in a setting that is predominantly MSM? So that's why we want to open up space. We don't want to, and the reason back, I need to give a little bit of history about it. Back in the day, HIV funding was just for MSMs. It was never for trans communities. It was never for lesbian communities. It was just men who had sex with men. So the data that people have is only based on men who have sex with men. But we do have a community that's been left behind, such as the lesbian community and the trans community, in accessing services. So this is why we create these platforms so people can have open and honest conversations. And to have a person in our community, LGBTQIA, which is an ally, not being a part of the community, but you're an ally of the community. And an ally is a person that supports the movement, the health advances, the human rights of the individuals. So we want to thank you, Dr. Morgan, for being a part and being an ally in our community. So that's my final closing comments for tonight. I would like to thank everybody who took time out of this COVID-19 to take up space. Like Natino said, we are going to take up space, not be asking for space, because the space is already here. Our visibility starts with us. There's going to be some challenges. There are going to be some hurdles. We're going to have some people in our own community who will back talk us and bring us down. Oh, why are they talking about PrEP? They want everybody to be promiscuous. Like you, these are things that we have to be prepared for. 2020 is the year of exposure. 2020 is the year of getting everything off your chest, no matter what it is. And I want to create that environment for our community to be free and have this open, honest conversation. Natino, I see you raising your hand.
Yeah, Dr. Morgan, could you give us the numbers for the HIV Prevention Center, or to make the contact with them? Like, let's say we've already been on PrEP. What are the numbers so that we can make online or virtual contacts so that we don't miss our appointments? Can you tell us that?
It's 323-5968.
Okay.
323-5968.
Okay, thank you.
All right. So that ends our Zoom for the meeting. Once again, thank you to Dr. Morgan. Thank you, Natino, for being a part of this. Thank you to everybody on this call. And also thank you to Victor. I'm glad that you're here to give a little bit of insight on the national program and so on, the accessing of NHI, because NHI is very important for our community. Persons do not understand the importance of NHI. It's a simple application. You go online, you fill it out, and you can access a private doctor or a public doctor, but they must be a part of the NHI program. We'll have a Zoom conversation surrounding that. So keep looking to our Facebook page, the D'Marco Foundation. You can find us on Facebook. You can find us on Twitter. We are there. We're always out there open and advocating on your behalf when it comes to your HIV health needs and LGBTI advocacy. The number to reach is 456-9413. And we also have Natino who will talk about the Bahamas Organization of LGBT Affairs contacts. Go ahead.
Yes. So just before we close and you guys leave, we want to invite all of you out to Pride, which is happening virtually. So it's October 5th through the 9th. And then I think we still have some other events that we're working with from the 9th to the 12th. And the Bahamas Organization, right now we're working off of the Facebook page and our email, which is Bahamas.org of LGBTI affairs @gmail. If you have an issue, if you have any queries, any questions, or if you want to report an incident of violence, contact us via the Facebook page. We're working alongside the D'Marco Foundation to make sure that this year's Pride goes off, and we're really excited about it. There's lots in store. There's a lot more conversations. We have people, we have Bahamians from the United States, Bahamians who are here, Bahamians from the Caribbean who are going to be giving us the research and the work that they've been working on. And we're going to have Bahamians within the Bahamas talking about what it means to be queer and have that, or LGBTQ, and have that representation within the Bahamian setting. So you don't want to miss it. It's October 5th through the 9th. You can go ahead on the Office of LGBTQI affairs page, and you could sign up there. All of the links for Zoom, the Zoom meetings will be available starting next month, and you can sign up and register as soon as they're up. So see you guys there.
All right, thank you for that. You can actually post it in the link for us, the Facebook page. We'll stay on the Zoom for about 2 minutes, so you can get those contacts in the Zoom chat box. Don't feel free to reach out to us at any time. Once again, thank you, everybody. We're going to post the links into the chat box for you so you can follow our social media pages. Once again, thank you for joining us, and see you next time at our Zoom meeting.
So did everyone got all the information? Okay, if everyone got everything, I'm going to X out now, and everyone have a good day. This was an excellent meeting. Thanks, Dr. Morgan. And so we will chat. Oh, I guess some more link was just added. Let me give some people to get those links. Victor, I see
Once
you have.
again, thank you to everybody. Don't reach out.
Okay, y'all have a good night.
Thank you, Tori, for being our technical advisor today, our technician, making sure that everything Thank you very much.
You're welcome.
Okay, bye-bye. Good night.
Good night.
Good night.
Good night.